Well, I'd like to welcome everyone to our meeting today. We have a fabulous turnout, partly because it's on Zoom and partly because Dr. Dastur's reputation precedes her. We're looking forward to a wonderful presentation. I'd like to thank the McGill University Research Center for Studies in Aging for sponsoring this event. And I'd like to thank you, Caitlin, the social media administrator, as to being the host and the manager of this virtual meeting. I hope everyone enjoys their time here, and I'm going to give the time over to Renata to introduce our guest speaker.
Well, first of all, I want to extend a warm welcome to you all, and I know that by your presence here today, that this is a topic of great interest to all of us in our retirement years. We are indeed privileged this morning to have with us once again representatives from the McGill University Research Center for Studies in Aging. Caitlin, thank you for doing what you're doing, hosting and managing. And Dr. Dolly Dastur, a clinical psychologist well known in the psychiatric community for her prominent work in dementia and Alzheimer disease, and who will share with us her knowledge and her experience and answer our questions on an important health issue. If you forget, is it Alzheimer? Dr. Dastur is assistant professor in psychiatry at McGill University and is the chair of the education committee of the McGill University Research Center for the Studies in Aging at McGill. She recently retired as co-director of the program in dementia with psychiatric comorbidity at the Douglas Mental Health University Institute. Born in Mumbai, India, Dr. Dastur came to Montreal in 1973 after 10 years in Nigeria at the University of Ibadan, where she was a senior research fellow in psychiatry and project coordinator for the World Health Organization project in schizophrenia. While working as a clinical psychologist in the memory clinic of the Douglas Hospital, Dr. Dastur specialized in the assessment of dementia, especially Alzheimer's, and has developed an assessment tool for the prognosis of this disease by studying models of cognitive decline with geriatric patients to obtain a diagnosis and functional picture of the dementia in patients. She was a founding member and president of the Alzheimer Society of Montreal from 1986 to 1991. And for her outstanding contributions to this field, she was awarded the C.A. Roberts Award for Clinical Leadership in 1990. I welcome you, Dolly. You are a real trailblazer in dementia care. So welcome.
And thank you for all for coming this morning. And I guess Zoom helps that you don't have to dress up and go and park or do whatever. So you're in your own home and you can listen to whatever you want. And I think this subject today is of much interest to all of us because memory is something which we cherish very much. It is very crucial to our consciousness. And there's nothing that one does which one involves our memory, our thinking, our perception, and we draw upon our past to place ourselves in the present, and we draw the present to plan for the future. So it's like a continuum process, and anything which happens, and especially as we get older, we sometimes forget a word, or forget something, forget where we put our keys, where we parked our car, or wherever, and so we panic. And we think that, oh my God, am I getting the big A? Am I getting to be demented? What's happening to me? But you should not worry, because every time you forget a little bit of things, it doesn't mean that you're going to get dementia. It's only about 10% of the people who have memory problems earlier will develop later on. And also we were given to understand that as we grow older, our brains don't function very well. We don't, and we keep saying that, oh my God, I'm 50 years old, I'm 60 years old, what do you expect? I can't do anything. But that's not true anymore. There's so much research going on. There's so much new knowledge coming out that our brain is so plastic that it changes, it flourishes with stimulation, it flourishes with good nutrition, it flourishes with exercise. So that's what we're going to talk about that you should not think that once you are reached a certain age, life is over. It's not over. It continues. You're in a very exciting part of our third decade of our lives. So let's go. So to start with, what is memory? Memory is not just one particular place in the brain which controls our memory, our thinking, or whatever. Memory is spread all over the brain. To give you an example, I think most of you must be from the West Island. So if you're taking a bike ride along the Lakeshore Boulevard, the very act of working on your bike comes from one section of your brain. The idea of how do you get from Lachine to Point Claire is another part of your brain. You may have had a near accident a while ago. With the shock of that comes from another part of your brain. Now that all works very intrinsically, and you don't understand or don't realize which part is working where, but the whole picture is there. But that keeps going on in your brain. And so this is what is a memory. It's a dance of chemical and electrical activity in the brain. Actually, the brain, we never think of brain when we were young or when we were growing up as how we were thinking or what we were doing. We just thought there was something inside that big box on your head, but we didn't know what was happening in that head. The brain is like a 3-pound jello-like muscle, and that contains so many neurotransmitters, contains vessels, it contains the circulation, which helps you to work. The brain keeps working, and there's a lots of these chemicals which go on from this brain stems, and you have an electrical activity in the brain. So it's a combination of both those. Now, as I said, memory is just not one area in your brain which controls everything. You have different systems, and the two most important systems are the explicit memory and an implicit memory. The explicit memory is also called a declarative memory, which you have to declare something. You have to consciously remember an action. You have to remember an episode or to remember some words. So the episodes which happens for events, that declines as we age. And why does that decline? Is that because we do not pay too much attention to what is happening. If it's just something passing. Now, what I'm talking today to you, you may remember it for a little while and it may go away after some time. The event doesn't stay in your brain. But the other part of your explicit memory is your semantic memory, which is for facts, for words, for images, for overlearned materials. And that does not decline with age. As we grow older, we don't forget our words. We don't forget how to talk. And that is not dependent on any retrieval. It is not dependent on any cues. It's just there. So that's explicit memory. And next to that is the implicit memory, which is a non-declarative memory, which where you don't have to do anything for it. It's your procedural memory for your motor skills. You're learning to walk, you're learning to talk, you're learning to shave, you're learning to dress, you're bicycling, you're car driving. All these are motor skills which are automatic actions. You don't have to make an effort to do. You don't have to get into the car and to say, now I have to put my key in, I have to turn, I have to put my leg to my pedal. It's just there. So these are two main systems of your memory, which is the explicit memory and implicit memory. And the implicit memory does not decline with age. You don't forget how to drive or how to bicycle or whatever as we grow older. It's just there. Okay, so how do we form these memories? I mean, I'm talking to you, you're going to form a memory of me, a memory of the words. How does this happen? This is the strength of connections between the cells. As I said, there are billions and billions of cells. There are about 100 trillion cells in the brain, and each talk to each other through different chemical interactions. The strengths of connection between the cells are altered by each experience. So every time you do have an experience, there's a connection. And if you repeat that connection, repeat that action again, there's a more connection. It's like driving a car over a road which has got soft soil, and the more you drive over it, the more you make a road, and that's how it happens in the brain. Okay, so also memory has different types of memories. As I said, there's a sensory memory, that comes through your senses, through your vision, through your hearing, through your touch, to your taste, and there's no loss with age. That is a modality specific. And if you want to put that sensory memory into remember it for a little while, that's what you'd want to make it into a short-term memory, which is called primary memory. And the short-term memory is very useful because it is like a working memory. You need that to do things throughout your day. When we had the telephone directories, we used to look up our telephone directories and look up the number and then dial the number and it will go away. It doesn't need to, you don't have to keep that in your mind forever and ever. It's a short term. It's a working memory. It needs to be repeated and rehearsed. And there is a minimal loss with age because we don't need it to use it all the time. But if you want to memory into a long-term memory, you want to remember it for a longer period of time, then you have to keep repeating it, and so that at least several times a day, or sometimes over a period of day, for a whole month, and that does not decline with age. It stays permanently with you. Now, there's a relationship between the primary memory, the short-term memory, and the long-term memory, which is the secondary memory, is interactive. And how you encode something, how you take in that information is more important than which will help you to recall. When you give an item and there's the strength between what you're learning is more important. When normally we give people, what President, what's his name? Trump talked about his test over there. They give you items to remember, to recognize, to learn, and then to recall back. Both cueing, they may give you cues for what that item you're looking at and to what you're going to be recalling. Also, the strength, association between the words. For example, if I give you the word like baby cries, you'll remember that much more than if I say baby fell off, baby accident or something. That will be more difficult to remember because there's no connection. When you make a meaningful connection between the words, you remember that much more. So just to give you a model, you have the working memory, then you have an immediate recall, and you have a delayed recall. So the working memory and the immediate recall forms your short-term memory, which is there from 30 seconds to several minutes. It doesn't stay forever and ever. And then the short-term memory turns into long-term memory, which can stay, with repetition will give you from 15 to 25 minutes, which is a longer period. So why does memory decline with age? If the brain is there, why does it decline? Because they're different, as I mentioned, there are different areas in the brain which are vital to memory. And the most important organ is the hippocampus. Now let me see if I can get you a picture. Yes, this is the hippocampus, this blue thing which is shaped like a snake. It stays in the middle of the brain, and that's the most important area which is essential for working memory, for short-term memory. What I'm saying goes into your hippocampus, it's processed there, and then it is sent to the frontal lobes, which is in the front of your lobes, which stores that memory. Next to the hippocampus is an organ called the amygdala, where our emotions associated with that memory is lodged. If you have a happy memory, the amygdala comes into play. But if you have a sad memory, the emotions also come into play. So, and what controls your memory is also your thalamus. That's another part of your brain, right in the bottom of your neck. How you pay attention to what is happening. That is also important. The parts of your brain which are important, vital to keep memory working good is your hippocampus, your frontal lobes, which are right in the front of your head, the amygdala, and the thalamus. And the activity in the hippocampus and the frontal lobes slows down. It doesn't stop, it just slows down. And that is due to the loss of connections between the nerve cells. Sometimes the connections slow down, and our effort should be to maintain the strength of those associations, and so that the constant connections are maintained. So yes, I showed you the hippocampus. Now the amygdala is somewhere here. The frontal lobes are over here, where the process takes place. Also, how do we preserve our memory? There are different ways to preserve our memory. The most important is our lifestyle. And in the lifestyle, we have to maintain cognitive activities, need to have a positive attitude to life, to use the efficient strategies. The lifestyle, suppose if your doctor tells you that your heart is not doing well, Mr. So-and-so, Madam So-and-so, you have to change your living habits, you have to do something, you have to change your food, nutrition, you have to do some exercise, you will do it. But the same way, to preserve your memory, you have to maintain your lifestyle. Because what happens to us, we say that, oh no, I'm born that way, it's genetics. But genetics only plays about 30% of your health problems. The rest depends on your lifestyle. 70% of your behavior is what maintains your health, what maintains your lifestyle. And in that, the important thing is first cognitive activities. Okay, in the cognitive activities, we can talk, is that right? Yeah, you talk about exercise. I cannot emphasize enough how important exercise is, not only for your body, but also for your brain. Because the brain likes movement. The brain doesn't like to be stationary. So the more you move, the more blood circulation goes on into your brain. The exercise makes it more fertile. And exercise is considered as a molecular fertilizer. We put fertilizers in our soil, we do exercises for our body, for our leg muscles, for our heart muscles. So we have to do the exercises for our brain. We don't see that brain muscle, but it's a muscle which needs exercise. Both, we need the exercise, we need both mental exercises and we need physical exercises. For physical exercises, you need about 30 minutes a day, about 3 times a week. And that is not enough, but it's the bare minimum which you can do. If you could do more, if you can walk every day, it's much better. And I personally feel that walking is a much better way, because you are talking to somebody at the same time, you are in fresh air, you are engaged, and that is, it exercises your brain, not only your body but also your brain, by thinking at the same time as you're walking. The other thing in your lifestyle which is important is diets. We have to be careful as to what we are eating, because what we eat in converts into nutritious and affects your brain. So it's good to have a pro-memory diet which is low in saturated fat but very high in fruits and vegetables. And vitamin B12, folate, which has spinach, citrus fruits, asparagus, beans, folic acid, vitamin E, which is in nuts and oils, protects your brain from aging. Now, somebody had asked a question about vitamin B12, that how important is vitamin B12? Vitamin B12 does affect your memory, but it's something which is there, and we taking additional vitamin B12 is not going to help you unless your vitamin B12 levels are so low that it needs a little more boost. But a good nutrition food, by taking a lot of folate, by spinach, or what I just mentioned, is much more important, by taking good food to increase your vitamin B12 level, so that to increase your memory. When you go to a physician and say with some complaints of your memory, they normally do a blood test. And one of the questions asked in the blood test is your vitamin B12 levels. And if they find that it's low, then they will maybe prescribe something for you at that time, but will tell you to take good food, get a proper good nutrition. Another thing important to preserve your memory is sleep. Sleep, we think is, oh, it's only good for your body, you're tired, I'm falling asleep. But sleep rejuvenates not only your body, but it rejuvenates your brain, because all the excess activity which was there in the brain, it sort of slows down in your brain time. When I was working in the Douglas Hospital, every afternoon we would put our patients, who had, all of them had dementia, to bed. Whether they slept or they did not fall asleep, but they had to close their eyes and lie down, because that makes the brain slow down. We also, what we call sleep-induced comas. When people are very ill and they have accidents or their brain is damaged, then they put them in a coma so that the brain has a chance to rejuvenate itself. They say that our generation, we live in a very sleep-deprived, it's a sleep-deprived generation. We don't sleep as much as we should. A little baby will sleep almost 20 hours out of the 24. And as we grow older, we need lesser and less sleep. But that does not mean as we grow old, we don't need sleep. because people said, oh, I can't fall asleep. I'm so old now. But if you keep napping all the time in the daytime, then sometimes it's difficult to fall asleep. So there has to be a regular pattern of when you fall asleep. And sleep, as I said, is very important, because they say that you can stay without food for, say, a week, maybe, on just a nutritious food of milk or water, but you cannot do without sleep. After 16 hours of no sleep, or at the most after 24 hours of no sleep, you cannot really function. You cannot think very well. You get confused. You get disoriented. And that is why one of the torture things is sleep deprivation. People are deprived of sleep with strong light falling on their face, things, so that you cannot think very well, and they will say whatever the torturer wants them to say. So sleep is very necessary for your memory functioning. Please get your sleep. The other thing important is stress. Now, nobody in this world is without stress. And if we have time, we can go into that in more details. But stress generates a hormone which is called cortisol. And that hormone is in your hippocampus. And that stress hormone shrinks the hippocampus. So when the hippocampus, which is receiving your memories, receiving the stimulus, is shrunk, it doesn't have enough space to have this input inside, then the hippocampus cannot function very well. So stress, chronic stress, also alters the brain function. I want to give you an example. I had a staff which used to be very difficult and used to stress me out a lot. And I didn't know what effect it had on my face or on my behavior or body. But when that staff left, people said, Dolly, did you go for a holiday? What's happened? You look so different. What's the matter? I said, no, I haven't gone anywhere else. So she said, you look more relaxed. You're looking different. I said, oh, it may be because that staff left. And now I don't have any more stress in my workplace. So that was how much stress affects you. And that stress also affects you when you're taking care of your loved one with a chronic problem, of a little child or an elderly or whatever. But stress is very important, and we must learn how to control the stress. Nobody is without stress, but we have to learn to control our stress. Another thing important for our lifestyle is the social and leisure activities. Now, those are important. Social and leisure activities are important. And but more and more research are showing that this is not as important as a good nutrition and a good exercise. Exercise and nutrition are more important than social and leisure activities. But I'm not saying you shouldn't have it. What you're doing today, what these organizations are doing, is very good, because you get together, and when you have social distancing, you are having at least you're having some face-to-face at a distance. And that is good, because we need that stimulation. We cannot do without stimulation. No. Okay, the other part of the lifestyle changes is you have to maintain your healthy body weight. You have to monitor your diabetes and good glycemic control, to control your hypertension, control your medication, and control your osteoporosis. Because all these things combined will give you a better quality of life. If you do not control your osteoporosis, your bones have become brittle and you're more likely to fall. And once you fall, your lifestyle changes. You may not be as mobile as you want to be. And diabetes go together. Somebody had asked a question as to, is diabetes considered the fourth, what was it? The question was, for the fourth condition for dementia. And yes, it is true, because diabetes affects your circulation. Diabetes affects your brain circulation. And if your brain is not very well irrigated, is not very well circulated with blood supply, then you cannot function as well you should. So diabetes is a detriment to a good functioning. And so that is needed. You need a good glycemic control to maintain your good supply of brain. Okay, the other thing which you can do to to preserve your memory, is to have cognitive activities. You have to learn a new activity a year, not something active, not something passive, but an active activity. Sometimes we say that, oh no, I'm quite active. I do everything every day. But the thing is, we keep doing the same thing every day, every day, every day. So the days, you're not stimulating different areas of your brain. You're stimulating only just one area of your brain, which is not good. You need to have activities doing, if you're going from place A to place B in one direction, in one route, try to follow another route so that you learn a new way. The another part of your brain is activity. If you're writing always with your right hand, just for fun, try writing with your left hand to see how does that work. Learn new things so that your different areas of your brain get activated and not the same area. Okay, the other thing is also use of efficient strategies. There was a time when we used to memorize things. I mean, I'm talking about, say, a couple of centuries ago. People used to memorize things. People who had strong memories, who could reproduce things, were revered people in the community. They were given high places. People used to construct whole poems, construct different things, all from memory, from rote. There was no paper and pencil. There was no notes, post-its. There was no smartphones. Everything had to be put in your brain. You had to remember things. But what have we done now? We've outsourced all that. We don't exercise our brain as much as we should. We have our smartphones. We have our post-its. We have our cameras. We don't even have to take films. We can take as many pictures as we want and throw them out if we don't want them, So we don't maximize the use of our brain. And that is why we're not, how should I say, it's not that we're not using our brains, but we're not using all the brain power as we should. So as I said, we're depending too much on external memory aids. We're depending on the agendas. We have filing systems. We write things down. Now, even writing things down is very helpful because what you write down gets transferred into your long-term memory and it stays there much longer. Okay, now let's see what are the 10 warning signs of a decreased memory. First is memory loss that affects day-to-day function. If you think that you're functioning, or your parent or your husband or your wife, you find that from day to day, they seem to be asking you the same questions or not remembering things. It's very subtle. It's not something which is very obvious. So that's a loss that affects the day-to-day functioning. That's one main sign. Then difficulty performing familiar tasks, things which you do regularly. For example, writing a check or paying your bills or doing your cooking or following a recipe. Those daily tasks which you have been doing for years, you sometimes falter. You sometimes don't remember, or sometimes you do the same thing again and again. Then you have problems with language. Sometimes the right word doesn't come out at the right time. That happens to all of us. We all have a tip of the tongue phenomenon where you meet somebody on the street, you know that person, but that name of that person doesn't come out. You forget. But as soon as the person goes away, it turns around and says, oh my God, that was Sally. Now I remember her name. Because that is the top of a thing. Sometimes you can't get, I used to, when my children were living with me, I would tell them, please go and get that. And they'll say, what is that? We don't know. So please name it. And that word wouldn't come out. And so that is a problem with language. Language also sometimes it develops, and we'll talk about a little later how it develops. Then you get disorientation of time and place. We're retired and we're not really following unless we have calendars which have changed the dates every day. We really don't know what date is. I usually get disoriented or confused whether it's a Saturday or a Sunday because every day looks the same. And in this pandemic, it's even worse because there's no differences in different days. You do the same thing, the same routine every day. And so there's bound to be a little bit of disorientation, and that is not good. We have to be careful of that. Then we have poor or decreased judgment. You find that the person you're living with, or your mother or your father, sometimes makes judgments which are not appropriate. They sometimes wear warm clothes in a cold weather, in a warm weather, and they wear no clothes, go out with very little clothes on, things like that. The judgment is, and this is more important when somebody has a has money and have been investments, and they make wrong judgments for investments, and that is not good. So that is, you have to be very careful with that. Then there's problems with abstract thinking. When we don't always need to have this object in front of us to do something. We have to we sometimes think of it in our mind and brain is the same thing. The mind operates within the brain. When you have to, what should I say? When you have to think of your day, when you get up in the morning and you think of what you're going to do the whole day, you don't have, you do it abstractly, you think about it. You don't have to have something. So the problems you solve sometimes, I have to think of something. What am I going to do for that? How am I going to work on that? So you think it out abstractly, but that does not happen when person is beginning to have decreased memory. You need the object in front of you to be able to do the work. Misplacing things, that's very common. We all misplace things. They say we spend about 1 month a year finding objects which we have misplaced. I have looked for my keys in all sorts of places. I've looked for something which I think is blue colored book, where it is really a red colored book, and I can't find it. So we misplace things, is common. You should not panic. But if you but we misplace it and we find it. But if you misplace it and you don't find it, then there's a problem. In accompanying to that is changes in mood or behavior. We normally think that dementia or decreased memory is only accompanied by decrease in memory, in thinking, in remembering. But it's also changes in mood or behavior, which is much more difficult to manage. Because somebody who was a calm, peaceful, pleasant person suddenly becomes angry for no reason, becomes agitated, starts throwing about things, becomes angry and screams. So there's a change in mood or behavior. And together goes with that is the changes in personality. As I said, a calm person may become agitated for no reason, So there's a change in personality. And the last would be to change in initiative, loss of initiative. The person has no oomph, doesn't feel like doing anything, doesn't feel like, shall we go to a movie today? No, I don't feel like going. You go. Shall we go to this party today? So we are invited to this. Are you coming? No, I don't want to go. I don't feel like doing anything. I just feel like staying at home. So there's no initiative. There's no desire to do something different. Okay. So now we talked of all these things which happen in normal aging. These changes which take place. Now we're going to talk of what happens in dementia. But before I start, I want you to realize that dementia is like a global term which covers very different types of dementias. And there are, you'll see the next slide, there are about 60 to 65 different types of dementias. And Alzheimer's is just one type of a dementia. Okay? So dementia is really it's a disease. It's not just, it just not happens because you're old. Dementia is a syndrome or a group of symptoms resulting from a structural loss or death of nerve cells in the brain. As I said, we have trillions and trillions of nerve cells, and they all die gradually. But there's so many that we don't notice them. But when they cross a certain threshold, and there are more loss of the death of the nerve cells, then you begin to have, it makes an impact. And how does it start? It has a very insidious onset. You do not realize that something is happening. Actually, it says that by the time it's noticeable to your family or to yourself even, the beginning of the changes in the brain has taken place at least 20 years before. So it is a very slow, gradual process which takes place. And it's a progressive decline in dementia. It starts slowly and it then gradually declines. Sometimes if you have a stroke in between, then it grows rapidly for a while, then it levels out again. Dementia destroys not only your memory, not only your cognition, but it also destroys and affects your functioning and your behavioral abilities. You don't function as much as you before, and your behavior changes. We said a little bit about how behavior changes with dementia. But less than 10% of people who experience lapses of memory develop dementia. Everybody who has a lapse of memory does not develop dementia. It's only about 10%. So please don't be afraid that you just because you had a little forgetfulness episode that you're going to develop dementia. No, it's not going to happen. And how these, and when before the symptoms starts, I said that the changes take place. The changes take place in the specific areas of the brain. And that is the areas which control our thinking and planning and control our learning and memory, which is in the central part of the brain. So those are the areas. And, and if we're not careful with our diets, and if there's lots of plaques being formed, that plaques is a fatty substances which line the layers of your of the arteries, and that it blocks the arteries, so the blood flow is not very good. And so you have your plaques like that, and within the cells itself there are tangles. There's just as you have a piece of string and it gets tangled up and you're trying to unwind it and it doesn't get unwound. So that was the how the tangles are formed. So there's no supply of blood going through that particular neuron, and that neuron dies. So that happens in the learning and memory area. It happens in the thinking and planning area. Okay, so what are the symptoms of memory dementia? This is in general, and in all different types of dementia, this happens. In some, much more than in others. First of all, most important is a memory impairment. And in addition to your memory impairment, you have other cognitive impairment, which is language functions, executive functions, apraxia, agnosia. Now, what are those? I want to tell you that the decline which takes place in dementia is the reverse of how the progression of a child takes place. Now, this is very easily to seen in your language functions. When a child is born, it just has sound. It doesn't have any speech as such, but it slowly develops speech. And that speech comes from forming words, identifying an object with the word. It begins to see the mother and it gets agitated because it recognizes it. It's mama and papa, or it wants food. So those are the language functions. So when the deterioration takes place, our development, which is there of language, when we're talking in sentences, we're making writing essays or doing whatever, language which is maximum begins to decline. People begin to lose the ability to find the right word, lose the ability of read exactly what is there. They lose the abilities to do different things. And as the dementia progresses, this language ability declines further and further and further, until in the end, if you've known anybody who is living with dementia, you can hardly speak a word. Or when they speak, you don't understand what they're saying. But that doesn't mean they want to say something, but they cannot. They say something and we don't understand, and they feel frustrated because we are not understanding what they're saying. So the language function is very important, and it deteriorates in dementia. The next is executive functions. Executive functions is our ability to undertake some tasks, to do some things, to execute different events, and that also declines. Now, apraxia is being able to do things with your hands and in your body. The way you dress, the way you shave, the way you make your coffee or whatever, that's apraxia, doing things with your hands and with your body. That function also deteriorates. See, because you don't recognize what you're doing. I had a patient whom we used to take her to the sink, and she would not, after from the bathroom, and she would not know what to do with the sink, how to open the tap, that the water was coming out, that she has to wash her hand. That is apraxia. They cannot function. Agnosia is things they're not recognizing the objects. They mistake something for something else. A very crude example which I could give you is that I used to have in my office a waste paper basket, and we used to have some patients coming in, and they would think that waste paper basket was a toilet, and they would sit on it till I had to pull them up again and take them out of it, because they don't understand the object, the meaning of the object, and they mistake it. Then you have the functional loss. You not able to function. But in all these things, you still have a clear consciousness. You're not like confused or disoriented. You can still talk a little bit, but you will not understand it all every time, but you still can talk, and there's no depression. The person with dementia, with Alzheimer's disease, at the beginning is not demented, not depressed. Okay, so what's the prevalence of dementia globally? In the year 2000, there were about 20 million. Now we are now in 2000 and almost reaching 2030. We've passed 215. We are 70. There will be 74.7 million people around the globe. That's a tremendous number of people to deal with. And by 2050, there'll be 131 million people. And unfortunately, it affects women much more than men. There's about 61% of the people who have dementia are women, as opposed to 39%. Now, it's unfortunate, but that's the reality of it. So, as I said, there are 60 different types of dementia. And the most common types are the Alzheimer's disease, which is 64%, which I have all the symptoms which I told you. Then there's vascular dementia. Now, vascular dementia is based on your hypertension, on your cholesterol levels, on your vascular system of your body. If that vascular system doesn't work, you may have a stroke, and that may cause you a vascular dementia. And those are preventable. It's not completely preventable, but it's manageable by controlling your hypertension, by controlling your cholesterol, by controlling your diet, by being careful. You can sort of manage your vascular dementia, but you can't manage, you cannot reverse your Alzheimer's disease at the present time. We don't know how to do that. Another type of a dementia, which is also not uncommon, but not that common, is the frontotemporal dementia, where the person loses the frontal part of your brain. The person loses this ability to execute functions, to control, our frontal lobe, as we said, controls our thinking and our perceptions. And if that lobe is not able to control yourself, then there's no lid on your behavior. You will say whatever you want to do. You'll walk, you will get up and go away, or say lurid things or not appropriate things. So those are the frontal temporal dementia, which is a bit more annoying than the Alzheimer's disease because there's no control. Alcoholic dementia, I used to see much more of the alcoholic dementia when I started because people were not very cognizant of the fact that you could control your drinking, how it affects it, and how it, with food, you can minimize the effect of the alcoholic dementia. You see, alcohol is a water-based substance. When you drink alcohol, you will notice that when we were younger, when we took alcohol and had at a party and had a bit more too much drunk, if you woke up in the middle of the night, you were always thirsty. You needed more water to be able to minimize the effect of the alcohol. The alcohol which we could consume as younger people, we cannot consume as older people because the water content of our body becomes much lower and we cannot manage that alcohol consumption. It's a fact. And also by eating proteins at the same time as alcohol, that also diminishes. That's why we always have nuts and peanuts and whatever together with your alcohol consumption. When you're drinking your beer or whatever, you have something salty or something proteins to be able to minimize that effect. Then what we call the Lewy body dementia. That's another type of dementia which affects the top surface of your brain, and there you mistake your perception is lost. You see different things in a different way. You're walking and there may be a little bit of a thread or a little bit of something on the floor, but you think it's a big thing and you try to cross that over with your legs, and so the perception is different in Lewy bodies, and you become more paranoid with that. You have more hallucinations with your Lewy body dementia, which you don't see so much in your Alzheimer's and vascular dementia, but you see a lot of it in the Lewy body dementia. But unfortunately, many of our doctors or physicians who do not have too much experience in all that, they label everything as dementia, Alzheimer's. And so we feel that everything, a little bit of memory losses, it may not be. It may be a frontal temporal dementia, it may be a Lewy body dementia, it can be anything. But every dementia is not an Alzheimer's dementia. But the common feature in all of these is a memory loss. But in Alzheimer's, it's much more pronounced than in the other ones. In Lewy body and alcoholic also is much more pronounced, but in frontotemporal, the memory loss is not as pronounced as in the other dementias. Okay. So just to recap, is Alzheimer's dementia is the most common form of dementia, 64% we said. And the World Alzheimer Report in 2019 stated that there are 50 million people globally, 8.9 million in East Asia alone, which will be the highest region in the world. And by 2015, half of all the people living with dementia will be in Asia. Now, I don't know how the pandemic is going to affect it, because most of the older people the pandemic has affected most of the older people and they have been dying off. So how the ratio is going to be affected, I cannot tell you. But we all know somebody with an Alzheimer's disease. And we are either living with somebody in our family, or we know somebody, or we have the friends or whatever, but we all are affected somehow or the other. And as I said, women account for over 2/3 of those over 65 with the disease. So we women, please be careful, eat well, sleep well, do exercises. And the annual societal and economic cost is growing rapidly. In 2010, the cost was 604 billion US dollars. I mean, I have US figures. And this covers both the personal loss and the economic loss. By 2021, that is today, the cost is 1 trillion. 1 trillion. I don't even know how many zeros there are in that, but there's 1 trillion. And that is even 1/13 of what the President Biden wants for his relief bill, which is 13 trillion. Okay, and the monetary costs, the costs in US for treatment costs in 2018, it was $290 billion. In 2050, it will be 1 trillion, is it estimated? That is the healthcare system plus the caregiver costs. Because the caregiver has to give up their jobs, they have to have family caregivers have paid many unpaid hours of care. In 2011, there was 11.5 million hours people had to give up. In 2015, there'll be 38.4 million hours. So the total value of unpaid care is $14.5 billion. Now, this is the amount of money which we save the government by giving up of our time. And we need to have some compensation for that. Who are the caregivers providing daily care? Mostly spouses, and they are also older. Some of them are employed. They're adult children, mostly daughters, and the average age is also 54 years old. So the adult child is like a sandwich generation. They may be looking after their grandchildren. They may be looking after their parents. So that sometimes they live in the same household, and 71% of these hours are supplied by women. And friends and neighbors help out some, but it's about 9%. So it's mostly spouses and the adult child. So let me quickly go through the stages of the Alzheimer's disease. It starts, as I said, very insidiously. It starts in a very mild stage where you have forgetful of recent events. You have a difficulty with doing complex tasks. You become suspicious. You become thinking, that person is looking at me. I don't know why they're. So there's a lot of suspicious going on. But you physically, you are in good shape. You are in normal examination. So this mild stage can last from 2 to 10 years. Now, when I started working, people would ask me if they had an early diagnosis, how long will this last? I was not able to tell them. I could say maybe 2 years, 5 years, maximum 10 years, But now we have so many more different intervention techniques. We have day centers, we have support groups, we have exercise programs, we have different things, stimulation, because the brain, a normal brain, as well as the brain of an Alzheimer patient requires stimulation. And the more the stimulation you provide to the brain, the better the brain functions. Stimulation is good. The mild stage then gradually moves into a more moderate stage of dementia. And that moderate stage is the same thing, all the symptoms of the mild stage, but in a more exaggerated form. There's more difficulty in cooking. There's more difficulty in handling money. You go to buy something and they may cheat you, might not give you back the real change, or you bring back, you don't know what they've given you. You're unable to maintain a home. I used to visit patients at home. I used to do a lot of home visits. And I would see when you go into the home, how well the home is maintained or not maintained. They may have stacks of unwashed dishes. They may have stacks of magazines. And you will laugh, but I would come back home to my house and start quickly cleaning up so that nobody would come to my house and tell me the same thing, you know. Sometimes they have difficulty in managing things, you know. When I used to visit them, people always used to offer me tea. And I would see that the place is not very clean, but I would not refuse it, but I would take it because I wanted to see how well they were able to prepare that action. They would boil the water, come and sit down, and water would keep on boiling. Then she would get up and close the stove and come back. And this would go on for a while, and I would never get my tea in the end because she would never be able to complete the task. The water was boiling all the time, you know. So those are the difficult things that they live in the present. Difficult to manage medications. They sometimes they have the boxes, but they sometimes forget to take it, or they don't know which day they've taken it. So that there's a lot of problems with that. Little recall for recent events, and there's more agitation and aggression. Now, with the technological skills taking place now, we can have programs which ring on your phone or on your wristwatch, which tells you to take your medication. It's time for your medication. There are different things. There's lots of technological advances which are helping people with dementia to live a better quality of life, which was not there about even 10 or 20 years ago, you know. Where are we at? Okay, the mild. Then the severe stage, which may last for 1 to 2 years, which is towards the end, with more difficulty in dressing. They may not be able to button themselves. They could not be able to, they may shave only half of the face. They may not be able to comb their hair. They have difficulty swallowing, so the food has to be mashed or given softer food. Then, as I said, because we have the deterioration in dementia and the reverse of a child's growth, when the child begins to have fecal and controls the fecal incontinence or fecal before the urine. And so this is the same way. They begin to have fecal incontinence as with severe dementia. Then they have to wear diapers. The gait disturbance is there. They cannot walk very well. But more important is, not more important, but equally difficult to manage is hallucinations and delusions. They begin to see things which are not there. They imagine things, they see things on the floor, they see things on the wall. And worst of it is they cannot even begin to recognize their own face. They see their face in the mirror, in the bathroom or wherever, and they think that somebody else. And I had a patient, as I said, who would think this, and she was a young patient because it was an early dementia. The patient would see herself and think that it was somebody else, and that was the husband was having an affair with another woman over there. So that was a very, very sad thing. So they used to cover up the mirrors so that you don't see that and you don't get upset about the other person in the house. So there's poor recognition of family, the poor recognition of themselves, and there's little recall of past life, and there's restricted vocabulary. What happens is as you also grow older and your dementia becomes more and more severe, you stop recognizing yourself. So when you visit the persons in nursing homes, you will see that the photographs and things are placed on the tables are those of themselves, but in the younger age, because they can remember themselves as a younger person than as they're today. I mean, even if you look at yourself in the mirror and say, oh my God, this is me. In the pandemic, you even look worse with all your hair. But that's besides the point. But you recognize yourself much better when, as a younger person. We used to have in front of the patient's rooms a memory box where we would invite the patients, the family, to bring objects to put there so that the staff would know who this person was in their lifestyle, and the person themselves will be able to recognize their room to say, oh, this is my room, I should go in there. And if you don't put a person's face as there now, because they will never remember them as that. They have to put them much before. We had a patient who was it James Day, what was it, with the dam in northern Quebec. He had built that, and he was very instrumental, and he had pictures of that taken there while it was being built, and he would remember that episode much more better than himself now. Okay, so this is very quickly, this is a healthy brain, which completely, and this is, look what the dementia brain looks like. It's all eaten up all around. And this is how the neurons are working. This is a healthy neuron, and this is where the lots of plaques are formed. And this is a dying neuron. Look at the difference in the two neurons. So do I have some little bit of 5 minutes, 10 minutes? Renata, you're muted.
Yeah, that's fine, Dolly, 5 to 10 minutes, and then we'll have some questions, I think.
Okay, so the risk factors are age, genetic factors, and environment. Age. In normal aging, we all lose our brain cells every 10 years, about 4 to 8% are lost. But by the time we grow older and older, more and more brain cells are lost. By the time you're 100 years old, 80% are lost. And if at all we live up to 150, 100% of our brain cells will be lost. So what does it matter? But I just saw a picture of a woman who was 110 years old, and she was wonderful. She was talking. And I also had a picture of a woman who was 97, was playing Beethoven's sonata on the piano, with such gusto. And people can live and do well. Okay. So genetic factors, we have 23 pairs of chromosomes, and it depends on which chromosome is affected. Chromosome 1 affected, there's very little chance of developing Alzheimer's disease. Chromosome 14, less than 4% chance, but more people who develop familial type of Alzheimer's disease, which is where the onset is between 28 and 50 years of age. Young people develop it, And there's only about 400 families around the world who have this variant on the chromosome 14, So that's another type. But the most common type where most of the people with Alzheimer's disease is on chromosome 19. And that is a genetic, and that also is, if you have the ApoE4, which is the most common variant of the Alzheimer's disease, almost everybody, or at least 60% of people with Alzheimer's disease have a variant on chromosome 19. Now, if you have a variant on chromosome 21, you have less than 1% chance. But people with Down syndrome, and if they live up to the age of 60, between 45 and 60, they will all develop, without exception, dementia, because they have 3 copies of the genes instead of 2. We all have 2 copies, but with people with Down syndrome have 3 copies, and that's on chromosome 21. Environment is also a risk factor. Education, lower levels of education, lower social. It doesn't mean that just because you have a low level of education, you will develop dementia. It means that with the lower level of education, you tend to have a lower socioeconomic status. With a lower socioeconomic status, you may not be having a poor diet. Your financial situation is bad. Your living conditions are bad. And all those things are risk factors. Hormones, your hormones in the body are also a risk factor. Head trauma, and those with boxers who lose consciousness with the concussions on the brain, or with EPO, those are, so we have to be careful and teach our children to wear helmets even when they go out bicycling. Hypertension, as I mentioned, we've talked about that. Hypertension is a risk factor, and Down syndrome is another risk factor. So what are the protective factors? Higher education, the opposite of poor education, because that gives you better coping strategies. You know how to deal with something, you know how to deal with better. When somebody, to give you an example, a spouse dies, and the father or the mother starts behaving a bit strange, and the people attribute that to, say, depression. They were not able to manage, but they were able to manage their life, even hide. They were able to cope with their dementing process because there was somebody else in the environment who would compensate. There may be a secretary in the office, there may be a spouse in the house, or children who they were living with, who will compensate for them. When that compensation part is lost or is taken away, then the coping strategy collapses. Estrogen stimulates the release of natural compounds in the brain cells. Exercise is a very protective factor. I cannot emphasize enough to how important exercise is for our brain. Anti-inflammatory or hypertensive drugs, which are prevent hypertension. Antioxidants. because oxidants which are there, which rusts your brain cells, and those affected, that causes the damage to your brain cells. Now, antioxidants are there also in your body, but as we grow older, it doesn't function as well as before. So how to increase the antioxidants? By taking vitamin E, B, C, and ginkgo biloba in its pure form, not in what you get abroad. Then you have the red wine. It's good, but not white wine, because the mold on the skin of the red wine acts as an antioxidant. And it's good news for people who would drink wine. But also, as I told you before, not too much wine. 1 glass is enough for women and 2 glasses for men. Cholesterol lowering drugs is a protective factor. A good diet is a protective factor. Social support and network. And spirituality. Spirituality means believing in something higher than you, and not only always start thinking of yourself, but thinking of other people, doing things for other people. It makes you feel good. So are there any treatments? There's nothing approved after 2003. Nothing seems to be working, but we are not now concentrating more and more on non-pharmacological interventions rather than pharmacological interventions. So I told you dementia has got cognitive loss as well as non-cognitive loss. In that you have agitation, wandering, vocalization, aggressiveness. A lot of that is much more difficult to manage than just a simple memory loss. And how do you manage this? You will have physically non-aggressive behavior, where you're pacing and inappropriate dressing, undressing, wanting to go out of the house, restlessness, or physically aggressive behavior where you can hit and kick and push, and they grab the nursing staff, or you grab your hand and don't let go of you, you bite and you spit. So those are physically aggressive behaviors. Then you can have a verbally non-aggressive behavior, where you keep complaining, your constant request for attention, you're screaming, but it doesn't really affect you. You can tolerate that. But when you have a verbally aggressive behavior where you're screaming, cursing, temper outbursts, and making strange noises. We used to have a patient who would keep tapping on the geriatric chair all the time and yell, and you can't stop that, unless you give them some medication to completely calm them down. So helpful strategies: restlessness, you have to distract them, calm them with music or touch, consider pacing as a form of exercise, change the routes, change the environment, repeated action. If the behavior does not bother you, do nothing. Distract with simple activities, change the subject, stay calm. The more you correct them with saying that, no, this is not true, this is that, and that is that, it doesn't work. Suspicion. Provide comfort, do not argue or try to reason, or do not take accusations personally. They sometimes accuse you of stealing or doing things. Don't take that personally. They don't really mean it. It's just that suspicion, that's a disease. Okay, you don't need to know that. So the other intervention, the non-drug therapy, is a music therapy. Music helps. Art therapy helps. Reality orientation by having calendars or giving them the proper dates and time. Reminiscent therapy, trying to go back to the olden times, to bring back the memories, make the brain active again. Movement therapy, which is part of like the exercise. Touch therapy and other cognitive activities help. Touch therapy is important because we all want physical touch. Now I know in the pandemic we don't have that. We can touch ourselves, but that's not the same thing. But in hospitals and in nursing homes, we never used to touch our patients, except when you brought a tray for food, or you gave them a bath, or you changed for the diapers. You didn't really touch people, and touch is very important to make people connected. Now we have more like hug therapy, we have animal therapy, we bring animals and they touch the animals, and those touch makes you feel human. What are the helpful strategies for common behaviors? Wandering. Reassure the person, distract the person, and put reminders of hats, shoes, and umbrellas out of sight. We used to have a patient, as I'm giving you, every 4 o'clock when all the staff used to change, she would stand near the door and wanting to go home, because she would say, my children are waiting, they're coming back from school, I have to go and pick them up from school. The school bus is coming. I mean, no amount of telling that, no, it's you're not in home, there's no school bus, that wouldn't help. So what we had to do was to distract her patient, or ask the staff not to use the front door, take another door so she doesn't see people going out. or to go out with her and then to go out in the walk for another, so completely distracted. Aggression, be calm and reassuring, give space to cool down, distract, look for immediate cause. So, okay, but the challenges at each stage is different. In the early stage of dementia, difficulties, they don't understand humor or jokes. You need more time to respond. They lose train of thought. So it's much more challenging. In the middle stage, there's trouble understanding everyday conversation. Ask the speaker to repeat the same simple sentence. They're not able to understand your facial expressions. Difficulty finishing a sentence. They're vague in their speech and they're rambling in their sentences. So it's a different type of thing. In the late stages, they lose the capacity for recognizable speech, although words or phrases may occasionally be uttered, but doesn't really make too much sense. Unable to understand the meaning of most words, they lose the capacity for recognizable speech. The language does not make sense to others and become totally mute in some cases. And in the later stage, the nonverbal communication becomes much more important. And at this stage, touch is important, because by touch, the person still feels connected to you or connected to somebody else. So nonverbal communications, as the dementia progresses, is very important. Now, this is a small thing, strategies for caregivers. Many of us are caregivers. What do we do? How do we manage? How do we look after them? The people in the late stage experience the world through their senses. They are living in their reality. We cannot try to bring them into our reality. It doesn't work. We touch, hold hands, bring them a smell of a favorite flower or a food. We used to have a kitchen where we used to cook and make a cake, so that the smell of it would make the aroma, I shouldn't say smell, the aroma of the cake would bring back some memories. Vision, videos of nature, soft calming sounds, that would be comforting. And hearing tones and rhythm of your voice may be smooth, giving a feeling of comfort and safety. And with progression of the disease, a person's perception of reality can become confused. However, it is their reality. You have to accept their reality and meet them where they are. You cannot impose your reality on them. Avoid contradicting them. That's a bad thing. Or convincing them that what they say is untrue. No, 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 this is not true. Mother, you don't know what you're talking about. That doesn't work. Try to bring them down to your reality will cause more frustration and make things worse. You have to try to connect to them at their level and not correct them. So as the disease progresses, paranoia becomes common. They think food is being poisoned, belongings are stolen, spying on them or trying to hurt them. These are the result of the disease, but they're not for willful, intentional. Although hurtful, they are not to be taken personally. As a caregiver, it is normal to feel a variety of emotions throughout all the stages of the disease. You sometimes feel frustrated, you sometimes feel like angry, you sometimes feel like hitting out. It is important to acknowledge your feelings, but you have to care for yourself and seek practical help and emotional support. How do you, and who are the caregivers? The informal caregivers, the family members, formal caregivers, the paid ones. Who do they care for? Why do they? All that. Well, some caregivers give 24 hours, 7 days a week, getting round the clock care is given. What are the tasks? Shopping, maybe helping with medication, managing finances and legal affairs, supervision to avoid unsafe activities, bathing, dressing, feeding, and helping the person use the toilet, or managing incontinence. And what are the pressures? The caregivers experiences, we experience depression. They may also experience suicide, physical illness, and premature death, and higher than in the general population. Caregivers have a lot of problems. Most problems are related to stress, and 40% of caregivers suffer from mental distress. High levels of stress hormones, as I mentioned, the cortisol levels with the hippocampus gets mixed up, and relationship is elastic. I mean, if you had a good relationship before this disease started, you can manage it. You can give the care with loving care. But if the relationship to start with was bad, and it becomes more and more taut, and you're no longer, it doesn't become a net, it becomes a sieve. And the first thing to go is your peace of mind. You feel trapped, and that is bad feeling that the caregiver has. So I'm very quickly, 2 minutes more. What is stress? It's a biological reaction to physical or environmental danger. Stress is always there. There's acute stress and there's a chronic stress. And acute stress is good. Some is necessary, but chronic stress is not good because it accelerates your aging process. And stress can be expressed as a physical stress, mental stress, emotional stress, and behavior stress. And all these things are to be managed. What are the 10 signs for caregiver stress? Denial, you deny the problem, no, everything is fine, or have anger, or you withdraw socially, don't go out with friends. There's a lot of anxiety, you feel depressed, you feel exhausted. If you're waking up 10 times in the night, you have sleeplessness. Then there's emotional lability, you feel guilty that I should be doing more for mother, but I cannot do it more, I feel exhausted. Then there's a lack of concentration, and there's a health problems for yourself. And now the 10 ways to reduce stress. Learn about the disease. See why. Do not have unrealistic realistic expectations about the disease, that the person can do these things. Why can they not do it, And also be realistic about yourself as what you can give of yourself and what you cannot give of yourself. Accept your own feelings also. Share your feelings with others. Don't keep it all bottled up. Share it with your siblings. If you don't have siblings, share it with your friends. Be positive and look for humor in the situation. Sometimes it's very funny what they're doing, But take care of yourself, get help, and plan for the future. Okay, I think this is my last slide. I would say that getting old is natural, but feeling old is optional.
I have one here. It says, my friend forgot how to walk downstairs. Is that a motor skill, or was it a fear that made it difficult for her to walk down the stairs?
I mean, it depends. What was the diagnosis? Why did she fall before? Is that the reason why she's afraid, or is there a difficulty in her musculature with her legs don't move? I don't know. I mean, there's many reasons why she's afraid to walk downstairs. Or she has a heart problem, her heart races where she walks down. She gets short of breath. She's afraid to walk. There's so many reasons. One has to isolate each of the reasons to find out what's the problem.
Let's go here. We have another question. It says, will grape juice have the same protective effect as red wine?
Yes, if you're making the grape juice yourself, but if you're buying it in the stores, there's a lot of preservatives put in the grape juice. It's not a real pure grape juice. I mean, eating red grape juice is good, but you have to eat lots of grape juice to be able to get that effect. Which you will get from a glass of wine. You need a lot of grapes. You can eat grapes, red grapes. It'll give you, but buying the preservative in the Tetra Pak is not a good idea.
I have a few more questions in the chat box. So one of them says, if 3 of my mom's siblings demonstrate dementia and her father, 2 of her 3 cousins also, is this indicative of my need to be on the alert for this illness?
Of course. Sorry to be so blunt, but yes, it is very genetic in your case. You should be.
Perfect. We have another one here. It said, I had a lot of chemo treatments. My oncologist said it is likely that my short-term memory has been affected. The question, will those memory cells ever reactivate themselves, or are they permanently destroyed?
I mean, they say, about 20 years ago, I would have said that, yes, your cells are permanently destroyed. But now with new research, what is happening is that we're beginning to see that maybe those particular cells may be destroyed, but the same information can be rerouted and the other parts of your body, other parts of your brain takes over. That is the plasticity of the brain, which you're beginning to see. That the brain is not a static organ, which we thought it was, that once the cells are destroyed, it's destroyed and period, finished. But now the cells may be destroyed, but it reroutes the information, it looks for other places, and that's how it looks. And they say that the older brain is not the same as a younger brain. The older brain asks for help from other parts of the body. I mean, I give you an example. They were done the tests where they were asking people to show them an object and want them to recognize it. The younger person would recognize it from one part of your brain always, whereas the older person would go to the other part of the brain to get some information from there as well. So that it was bilateral rather than being just, because we normally think of objects being seen on the right side of the brain and the words being seen on the left side of the brain. That doesn't happen when you're older. It intermingles, and the brain is becoming more and more plastic as we are aging.
Can brain cells be regenerated, or do they simply just gradually diminish forever?
As I told you, I mean, they do diminish, but the other parts of the brain compensate if the rest of your brain and your other bodily health is good.
Perfect.
They do compensate. And as I showed you in my slide, if you're living up to 150, everything is going to deteriorate.
I'm going to close to the question and answer period.
I would really like to thank Dr. Dolly Destour. We've had a tremendous response to this talk. I've seen people texting at the top of my screen how much they enjoyed the presentation. It's so reassuring to know that we're not doomed to dementia just because we have an aging brain, that there are things we can do to keep our brain active. So thank you again, Dr. Destour. It was just so informative and a topic that we should all be very interested in.
Thank you very much, everyone, for attending. And I'd really like to thank Renata for all her hard work in planning everything and being our liaison with Dr. Dolly Destour, as well as Caitlin. Goodbye, everyone, and have a good, safe day.